this real quick. Okay, hey, I'm Merrill Rogers, and Lillian is with us, and Lorna. And so first we're going to talk about the introduction and purpose. So basically, healthcare professionals and the general public have difficulty understanding the role and scope of occupational therapy. And it was found in our research that most healthcare professionals surveyed demonstrate a lack of knowledge about the roles and responsibilities of occupational therapists. And this can be an issue because it leads to a decrease in referrals for OT services and poor client outcomes. In fact, OT is the only profession in which our work correlates with lower hospital readmission rates. And clients also need to be aware of what OT does, as they need to advocate for referral and for services when necessary. So, but the purpose of our literature review is to reveal the gaps in understanding as they relate to healthcare professionals and the general public, so that OTs can advocate for their profession and their importance as a member of a multidisciplinary healthcare team. So we have two objectives. The first is what factors influence the gap in understanding the need for OT services among clients and healthcare professionals. And the second is how can OTs better advocate for services amongst other healthcare professionals and clients. Next, we have our methods. We use the PRISMA SCR method during our scoping review process, and we obtained relevant articles by using the following databases: Senate Hall Complete, HealthSource, Medline Complete, Public Health Database, and Wiley Online Library. In order to find our articles, we use the following search terms and phrases: occupational therapy, advocacy, healthcare professionals, clients, rehabilitation professionals, referrals, a tech. We then synthesize peer-reviewed journal articles, systematic reviews, meta-analyses, randomized control trials, descriptive studies, a Slagle lecture, and 3 web pages. This flow chart, as you can see on our screen, describes articles screened and included in the literature review. Now we're going to have Lorna talk about the findings and discussion. All right, so for the first, we had Manny and Bellin in 2020. They surveyed physicians and specialists with a minimum of a Bachelor of Medicine and Bachelor of Surgery degree. They found that 32% of the respondents reported being familiar with the field of OT, 50% reported hearing about OT, 18% reported not being familiar, 77% reported sometimes or occasionally referring patients to OT, and 10% reported that they often refer patients to that profession. So next we have Darwish in 2018. He surveyed different healthcare professionals and clients who had received OT services. He found that only 1% of respondents had distinctive knowledge of OT, 13% has above average knowledge, 38% had average knowledge, 38% had poor knowledge, 10% had no knowledge, and 28% were unaware of OT. So this last findings that we had Darwish in 2018. He measured the awareness and knowledge of OT among healthcare professionals and clients. He found that more than half of the sample had little to no knowledge of OT, and 28.3% of the clients were unaware of the profession. Alababi et al. In 2015 measured the awareness of knowledge of OT among final year health science students. They found that 21.4% of the health science students were uncertain about the role of OT, 77.1% learned about OT from colleagues, and 28.1% learned about OT from their academic programs. They also found that 94% of radiologic science students and 17% of medical students were aware of the profession. So overall, to promote the profession, clients' health outcomes, and initiative change, OT practitioners must familiarize themselves with the various advocacy methods and implement these methods into the field's practice. Now we have Lillian to discuss limitations.
This literature review had potential limitations that should be noted. The first limitation is that the sample size was not a true representation of the population, secondary to a few healthcare professions being sampled. Another limitation was limited access to data within the United States across the identified themes. So as a result, the research study was restructured to include articles from different countries, which can introduce cultural bias that can influence the overall results of the literature review. The final potential limitation is the variation of data collection methods, in this case survey, amongst the reviewed studies, which could potentially influence the analysis of this study. Further studies should sample a variety of healthcare professionals and utilize a higher evidence level data collection method. Thank you.
All right. We'll